Good evening, everyone. I'm Keris. I'm the lead tissue viability nurse at Hampshire Hospitals. I work within the Fundamentals of Care team, and we're a team of specialists with our aim being reducing harm and keeping our patients safe when they have their hospital stay with us. So tonight we're talking about medical adhesive-related skin injuries, and that's what our abbreviation MARSI stands for. So our learning objectives tonight. So we want to be able to identify MARSI. So that's understanding the signs and symptoms of MARSI and empowering yourself to recognize and address it promptly. Preventing MARSI. So we're going to look at how we can choose the right adhesives, assess skin conditions, and apply the best practice to prevent MARSI effectively. Management of MARSI. So exploring approaches for managing MARSI and ensuring optimal patient care. And then we've got some case studies near the end. And these case studies were done at Hampshire Hospitals, and that was through the tissue viability team and our colleagues in the community children's nursing team. And this gives us some really practical insights through real world case studies that highlight the successful MARSI management strategies utilizing a good adhesive remover. So, as we said, our MARSIs are our medical adhesive-related skin injuries. So what is a MARSI? So it's skin damage caused as a result of application of adhesive products. So these are things like adherent dressings, tapes and devices to the skin surface. It occurs across all patient groups, particularly at the extremes of life. So we're talking about our neonates right up into our elderly frail or even our end-of-life patients. But it can occur across any kind of group of patients. Under-recognised and under-reported across all healthcare settings. It is preventable, so it's an avoidable harm. And there can be an assumption that minor injuries are a normal part of care. So the impact of MARSI on our patients. So it can cause some quite significant pain for our patients. It can lead to an increased risk of infection. There is a potential increase in the wound size and a delay in healing. A reduction in the quality of life for our patients can lead to deeper tissue injuries. And there is obviously an increased cost and resource demand for things like service provision, nursing time, additional treatments, and the supplies required. So we've got some pictures here, and I will just talk you through what's happening with MARSI. So our skin cells can separate when there is adhesive that's been removed from the surface of the skin. And it occurs when that bond is stronger than the bond between the skin's layers. It can cause separation of the epidermal layers or complete separation of the epidermis from the dermis. Repeated application and removal can compromise the skin's barrier. And this can initiate inflammation and a wound healing response. So some adhesives, such as acrylates, increase in strength over time, and that causes a stronger bond. Components in the adhesive may cause skin inflammation leading to a contact or allergic dermatitis. And the types of medical adhesives. So we've got our silicons, our acrylates, and our hydrocolloids. You've got bordered foams, we've got films, you've got ostomy and stoma devices, different tapes, securement of critical and non-critical devices, our wound closure devices, electrodes, so think about ECG monitoring, and our medicinal patches. So who's at risk? So a prevalence audit revealed 8% of children in hospital had adhesive tape-related skin damage. It's the most common source of skin breakdown in neonatal intensive care units. And it's really important here to just bear in mind that our neonates' skin and the way the skin is compromised and then it's made up, the layers within the skin differ to adult skin, so they're really very vulnerable. 15.5% of long-term patients in long-term care had adhesive tape-related skin injuries, and adhesive tape was cited as the third most common cause of skin tears, following hospital bed injuries and injuries sustained during patient transfers. And dressing removal is one of the top 10 causes of skin tears. So it's really important that we can get the removal and application of dressings done the right way to keep our patients safe. So risk assessment for MARSI. So we've got our intrinsic and extrinsic factors. So our intrinsic factors are typically things within us as a person, and our extrinsic are things that can be in the environment around us and things that are affecting someone from outside in. So intrinsically, we're talking about the extremes of age. So like we said, our neonates and our elderly patients. Race and ethnicity can affect the assessment for MARSI. Dermatologic conditions, so eczema, dermatitis, chronic wounds, EB, Stevens-Johnson syndrome. There are lots of different things to consider here when we're looking at our patients for our risk assessment. Underlying medical conditions, so diabetes, renal insufficiency, immunosuppression, malnutrition, and dehydration. And with our extrinsic factors, it's things like dryness, so it could be a harsh skin cleanser, excessive bathing, low humidity. It could be prolonged moisture exposure, so our incontinence, wound exudate, bodily fluids, you know, the list goes on. Anything that's in contact with the skin that's causing moisture or potential moisture damage. Medications, so our anti-inflammatories, anticoagulants, chemotherapy, and corticosteroids. Radiation therapy, skin friction, edema, tape, dressings, device removal, and repeated taping. We have three main types of MARSI. So our first is a mechanical. So this is epidermal stripping or trauma, skin tears, and tension injuries or blisters. Our second is dermatitis. So this can be an irritant contact or an allergic reaction. And our third is folliculitis and maceration. And we'll touch on all of these going on now. So our epidermal stripping, as you can see in the picture there. So this is removal of one or more layers of the stratum corneum occurring following removal of adhesive tape or dressing. These lesions usually are shallow and irregular in shape, and the skin may appear shiny. The open lesions may be accompanied by erythema and blister formation, and it's caused when the medical tape is repeatedly applied and removed, or when the adhesive used is too strong for the application. So skin tears are caused by shear, friction, and/or blunt force, resulting in separation of skin layers. They can be partial or full thickness, and they can occur when products are applied or removed with tension or friction. And our tension injuries or blisters. So this is the separation of the epidermis from the dermis, and it's caused by shear forces. More likely to occur when the skin is stretched or distended underneath an unyielding tape or dressing, and they're more prevalent over joints if an inflexible adhesive or device is used. Our irritant contact dermatitis. So this is a non-allergic response. It occurs as a result of a chemical irritant, and it's a well-defined area correlating with exposure. There's erythema, edema, and vesicles. They might be present. So our vesicles are our really little tiny blisters, and they can be fluid-filled. Typically, it has a shorter duration and more likely to occur with extended exposure of that irritant. Increased incidence when the skin preparation or the barrier products are not allowed to dry prior to adhesive application. So it's really important to let that skin, if you've cleansed it, if you've applied a barrier, let it dry before you're putting anything on top of there. So our allergic dermatitis. So this is a cell-mediated immune response. It's usually to a component of adhesive or the backing. There's erythema, those vesicles, those tiny little blisters, and it's pruritic, so it's very itchy. It corresponds to areas of exposure, and it can go beyond this. So it's usually a defined area where that irritant has been in contact with the skin, but that doesn't mean it won't extend past that. And it can persist for up to a week. So our folliculitis. So this is inflammation of the hair follicles, as you can see in that picture there. So they differ to our vesicles, those little tiny fluid-filled blisters. They're specific to those hair follicles. It occurs when irritants become trapped between the skin and the adhesive for an extended period. And they occur more frequently with highly occlusive tapes or when the patient is allergic to a component of the adhesive itself. And maceration. So again, in that picture, it's a change in the skin resulting from moisture being trapped against the skin for a prolonged period of time. The skin can appear wrinkled, white, grey. It can be a different tone to the normal skin tone. And softening of the skin results in increased permeability and susceptibility to damage from friction and irritants. So it's affecting that skin's barrier, the skin's natural barrier. It's affecting that, and it can allow things in, and it means the skin is really susceptible to damage. So as we mentioned before, prevention is better than cure. And this is something that's completely preventable. So we should be trying to do everything that we can to prevent these injuries from occurring. So what can we do? We can identify these risk factors that we spoke about. We can prepare the skin properly, select the appropriate medical adhesive, apply the adhesive correctly, and remove the adhesive correctly. So preparing our skin. We're going to observe the skin for signs of impaired integrity. So look at our patient's skin, have a really good look head to toe. Are there any areas that look particularly vulnerable? Is there any area that you're worried about? Address excessive moisture such as urine, exudate, like we said before, anything that's wet and in contact with the skin. Ensure skin is clean and dry before the application. You want to apply a barrier film in high-risk patients, and this provides a protective interface between the skin and the adhesive that's being used. And don't shave your patients. If you can, use clippers. And we spoke about folliculitis earlier, so shaving can cause that, and clippers is just a more gentle way of removing hair. Selecting our appropriate medical adhesive. So selecting dressings and devices with the lowest level of adhesion required while ensuring security with consideration to wear time. So avoiding adhesive tapes and dressings in high-risk patients, and use a tubular gauze to secure the dressing if you can. So that's something like ComfyFast, your blue line, your yellow lines, you can cut it to size, and it's really easy to just pull on over a limb or somewhere to secure the item that you need to be secured. If there's likely to be edema or distension, consider a product that will stretch to accommodate that edema. So that surface area of the skin, the size of the limb or wherever we're talking about on the body, if there's edema, that skin is really vulnerable, it's distended, that skin barrier is stretched. We need to really look after that area. And we also need to be mindful we're not putting tape around the circumference of a limb, for instance, that's got edema, because it can act like a tourniquet. So application advice for adhesive devices. So applying our adhesive product without tension, pulling or stretching, smooth into place with a firm, gentle pressure and avoid gaps and wrinkles, and use a gentle, stretchable product if there is edema or movement is anticipated, and consider the direction of the stretch. Removing our adhesive. So consider using a silicone medical adhesive remover such as Lifties, especially for our high-risk skin. So remember, we were talking about our elderly patients, our neonatal patients, or someone that you just think they've got that really fragile skin and you need to be really careful. Damaged skin or any potential or actual pain at dressing change. And again, your patient might be a very good historian and they might tell you, I get pain at dressing change because I find the removal very painful. So this could be a really good prompt, a good time to use your silicone medical adhesive remover to just alleviate and help prevent pain on dressing change. Remove the dressing and tape gently and slowly, keeping it a low profile with the wound. So that's really important to remove that device, that dressing, in a low profile to the wound, and supporting the newly exposed skin during removal. Removing the direction of the hair growth. Again, think about our folliculitis, and observe skin for damage at each dressing change or adhesive removal. So managing our MARSI. So our skin assessments, like we spoke about before, these can be daily or at every device change. Now you might do this electronically on an EPR system, you might do this via paper format, but it's very important to have a good look at our patient's skin. History of sensitization or allergy, so consider a patch test. Allergies should be noted on the medical records, so just check that and bear that in mind. Determine the severity of MARSI to guide management, really important. And then our skin tear classification, so our ISTAT. So this is our international skin tear advisory panel. So we've got our type 1s, which is no skin loss. So this can be a linear or a flap tear, which can be repositioned to cover the wound bed. Our type 2, so this is a partial flap loss, and this can't be repositioned to cover the wound bed. And type 3 is a total flap loss, so there's no skin flap there, and it's exposing an entire wound bed. So our skin tears. We want to try and preserve the skin flap if you can. You want to protect the surrounding tissue using a skin barrier. You want to reapproximate the wound edges without undue stretching. You want to try and reduce risk of further injury and document direction for removal of the dressing. So I can speak from experience, this is really important. So a little arrow on your dressing, so it's clear for whoever's going to be removing that dressing, which way they need to remove it. Because if it's done in the wrong way, it can actually remove whatever flap you've tried to reposition over the wound completely, and you'll have no skin flap available. And assessing for your signs of infection. So our non-sting medical adhesive removers. So adhesive removers are solvents formulated to dissolve adhesives. It allows for a gentle and can reduce the pain upon adhesive removal. So it's going to mean there's a gentle removal of dressing, tape, whatever item or product you've got on there. And it removes that adhesive residue that can be left on the skin. So Lifties, a medical adhesive remover, is a silicone-based and alcohol-free product. It's got a non-sting formulation, easy to apply, it's got a fast action and a quick dry time. And as Jodie and I were saying at the beginning, time is precious, so a quick dry time is great because you're going to have used it and then it'll dry nice and quickly and you can get your next device, tape, dressing in place. There's a 50 ml aerosol, and that's got a 360-degree use with a bag on valve technology. So again, from experience, perhaps when you're on your own with that patient or the wound is in a difficult area, you've got that 360-degree use. It's going to work no matter which position you hold and spray the remover in. And it also comes in a wipe format, which we'll talk about, and why there are benefits to having it in a wipe format. It's a very versatile product. So you can see in the pictures here, stoma bag removal, our fabric dressing removal, you can spray on there. And then for our medical devices, removing tapes and fixation devices. So our case studies at Hampshire hospitals. So we commenced the evaluation over a period of 1 month, and that was ourselves, the tissue viability team, and our children's community nursing teams. We evaluated Lifties, and evaluation forms were provided to us by Medicare Plus. You can see there one of the forms. So 100% of the feedback stated Lifties was the same or better than the current product used. And we did some feedback for 8 patients. So our first case study, it was a 7-year-old. There was a removal of adhesive dressing. So this was a Hickman line dressing change. So the nurse compared Lifties as excellent and better in comparison with previous products used. And there was no pain or stinging when applying. And the patient was very sensory and reported it was cold but tolerated it well. And the dressing was easy to remove and it left little residue, and the new dressing stuck well. So our second case study, so it's a 2-year-old, it was a removal of adhesive dressing. And again, our nurse compared Lifties as excellent in comparison with the previous product. There was no pain or stinging when applying. And overall, the cost of the product will be less, as the child usually requires at least 3 sachets of liquid, whereas the aerosol will be used for multiple dressings. And as a clinician, you will dictate with your aerosol how much you need, which is really handy. So you don't feel obliged to use up a whole sachet, for instance. And the child was upset for a much shorter time. The parents were really impressed and pleased with how much shorter the dressing change was and how this shortened the emotional distress for that child, which again, in these groups of patients is so important if we can reduce the emotional distress caused by things like a dressing change or line care. And our third case study was a 2-year-old, and this was removal of adhesive dressing So PICC line, dressing change, and our nurse compared lifties as better in comparison with the previous product. There was no pain or stinging when applying, and the patient was very young and will most likely get upset at dressing changes. However, lifties was easy to use, quickly removed the dressing. There wasn't much needed to slowly remove the old dressing, and after appropriate cleaning, the new dressing stuck well, so there was no obvious residue left. So in summary, MARSI can have a detrimental effect on a patient's quality of life, and it can lead to pain, increased risk of infection, and increased wound size. So what can we do as clinicians to help eliminate the incidence of MARSI? We can assess our patient's skin, and we can do this well and thoroughly. It's really important if we can. Identify any risk factors like we spoke about before, so our intrinsic and extrinsic risk factors. Ensuring correct skin preparation, so things like if you're cleansing, or if you're applying a skin barrier beforehand, making sure that is dry before you're applying anything else on there. Selecting the appropriate product for our patient. So are they high risk? Is there something you could use that you know is gentler for the skin? Or have they got allergies? Have they got a known irritant? Make sure we're not using it. And ensuring correct application and our removal techniques are correct as well. You know, as a clinician, it's really important to spend time reflecting on our practice and what could we do better, perhaps, to prevent these type of things, to prevent these injuries that are preventable. So I think for you guys out there, maybe have a little think about, from what you've just sat and listened to, is there something you feel you could take back to practice now? Is there something you think, actually, maybe I will bear this in mind, or perhaps I could have a look at this and do this a little bit differently to try and keep these things from happening?